And the topic for today is psoriasis and psoriatic arthritis. So before we're going to start, let me tell you something about psoriasis. This is an autoimmune disease that affects about 8 million people only in the United States and about 125 million people all over the world. And out of those, about 30% of people, they have psoriatic arthritis that we're going to talk about during this podcast. But before we start, let me tell you a little bit about Dr. Maria Robinson. She is a medical doctor. She has an MBA. She is double board certified as dermatologist and dermatopathologist. She has a great experience of over 10 years, and she worked in academia, private practice. She also did telehealth, and today she's a consultant for health tech companies and a medical writer. We're going to talk about Dr. Mary McGonagle. She is also double board certified as dermatologist and dermatopathologist with 20 years of experience. And she is a graduate of famous schools from Philadelphia College of Osteopathic Medicine to famous fellowships like Ackerman Academy of Dermatopathology in New York. And both of them have powered up and have united their forces to do a lot of education for people with skin diseases, which are chronic diseases. Ladies, thank you so much for accepting the invitation. I'm very, very happy to have you both here.
Thank you. I'm happy to be here. Thanks for that great introduction.
Yeah, thanks for having us. And thanks for inviting us on your podcast and for all the work that you do. I mean, we greatly admire you and how you're spreading the word on joint diseases. So thank you.
Today, we're going to talk about psoriasis, and I'm going to start with a simple question. What is psoriasis and how does it look? Because patients get confused all the time.
Yeah, so that's a great question. And you sort of touched on it a little bit, but it's a really common chronic skin condition that we see all the time in the dermatology clinic, and also primary care people are also saying it. As you mentioned, it's pretty common. So over 8 million people have it in the US, and it can affect people of all ages. There are a few different types of psoriasis. The most common one is called plaque psoriasis, and it's called plaque psoriasis because your skin grows too fast and forms thick plaques that are scaly. These plaques can be painful or itchy or just really uncomfortable. They can happen anywhere in your body, but most commonly are in places like your elbows or your knees, your scalp, your lower back. And they can be a little tricky to diagnose sometimes. So in people with lighter skin, they usually are red or pink in color with white scale that can be flaky. But in people with darker skin, they can be a little bit more like brown or violet with more of a gray scale on top. And in people with darker skin, one of the main issues is that even when the plaque clears up, like it's treated, you can still be left with this tan or brown flat patch that can last for months. And this is called post-inflammatory hyperpigmentation. It's something we see all the time in dermatology, and it can be just as distressing as the original disease, as psoriasis. So.
Let me ask you something else. When does psoriasis start? And if there are any risk factors and possibly risk factors that people can address?
Yeah, so psoriasis can actually appear at any age, from infancy all the way into your elderly years. But there are two peaks of age of onset that have been reported. One that occurs between 20 and 30 years of age, and a second that occurs between 50 and 60 years of age. However, in about 75% of people with psoriasis, the age of onset is before age 40. And psoriasis is known to run in families, so there's definitely a genetic component. There was one large survey that showed that if both parents suffered with psoriasis, the risk of their child developing psoriasis was found to be around 41%. Whereas if the risk was with only one parent having it, it decreased to 14%. And if only one sibling was affected, the risk decreased even further to 6%. But in genetically predisposed people, some things can actually trigger a psoriasis outbreak or a flare, like certain infections like strep infections, the most common being strep throat, as well as HIV. And stress certainly can worsen your psoriasis. Certain medications can trigger a flare, most commonly lithium or beta blockers. And the use of alcohol can definitely trigger a psoriasis flare. And what's really interesting is that some people can even develop psoriasis after their skin sustains some kind of trauma or injury, like a cut or a scrape, or even in recent surgical scars. And this phenomenon is known as the Kebner phenomenon. It's named after the German dermatologist who first discovered this.
Do you think psoriasis can be cured? That's a question that I get from my patients when it comes to autoimmune diseases.
Yeah, so I guess it's a little different. Do I think it can be cured or can it be cured? I mean, so far there's no known cure for psoriasis. It tends to be a chronic condition that waxes and wanes. So some people can be in remission, meaning their skin is clear for months to years, especially if they're with good treatment. And then they might experience a flare or trigger based on some of the things that Mary just mentioned. And in the last 20 years, there's been just a huge growth of the number of therapies. I mean, not just for skin disease, but for joint disease and other conditions of these medications like biologics that target a specific part of the immune system and can really knock out psoriasis, for example. So there are great therapies out there, but even those tend to be chronic medication, meaning that if you stop it, your psoriasis will come back. So for most people, psoriasis is a lifelong condition that comes and goes, and you do need a management plan for your life to manage it. Having said that, you will hear about people who have said that they've cured their psoriasis or gotten it to go away completely. And sometimes this is based on changing, dietary factors or lifestyle factors. And this is probably possible. And I think this is sort of what we're learning about as we learn more about inflammation and sort of the root cause of psoriasis and other skin conditions. It's definitely possible that some people will be able to keep their psoriasis at bay, long term. So it is a little bit individualistic and requires a little bit of detective work. So I think that I'm always hopeful about that. So, I think it just takes a little bit of time.
And thank you for bringing up the idea that there are great treatments that we have today for psoriasis, because patients will be interested to know what is new out there that could help their skin disease. But they are also, in my experience, very much interested to see what can they add from the natural options to treat their psoriasis. And my question is, what are a few examples of natural options that these people can choose to treat their psoriasis, most of the time in combination with medications?
Yeah, there are a lot of natural remedies that can help them even lessen the need for their medications, which is wonderful because the less exposure to some of these medications, the less risk of side effects. And some of these natural remedies include stress reduction practices like yoga, meditation, or breathing exercises. I'm a huge fan of meditation and breathing exercises. They're free, they're easy to learn. You don't even have to take a paid for course to learn them. You can learn techniques on YouTube, for example. There's also the age-old practice of climatotherapy. It's also known as climate therapy. And this typically involves traveling to a place whose climate will have a positive effect on your psoriasis. And go figure that this usually involves the ocean and the sun, right? Like whenever we travel to places like that, our stress immediately reduces. But a very famous practice involves people soaking in the Dead Sea for this very reason. But it's not just the stress reduction qualities that go along with this. There's actually very therapeutic and medicinal minerals in the seawater that also even dissipates into the air above the water that you are surrounding yourself in. And you basically get a topical treatment just from dunking in the sea or walking in the water near it. Acupuncture has been brought up in the past, and it's kind of controversial because of that Kebner phenomenon that I touched on earlier. So it's not that everyone would experience Kebnerization if they try to get acupuncture, but I would caution the listeners and always recommend that they seek out a reputable and licensed practitioner before pursuing anything like that.
Now, we're going to switch a little bit towards psoriatic arthritis. Some of the patients that I have, they come from dermatology office. They are referred to me to evaluate for psoriatic arthritis. How do you approach that? How do you ask patients about those things? How do you figure out that there might be need for a rheumatologist to get involved into the care?
Yeah, it's a great question. And as you mentioned, psoriatic arthritis is actually pretty common in patients with psoriasis. So 1 in 4 people will have it. I think the majority of people will experience the joint disease, the psoriatic arthritis, after the start of the skin disease. So, about 10 years is what I've seen. But not everybody. Some people will have joint disease beforehand and not even have skin disease. From our perspective, at least for me personally, I assume that there's going to be joint disease and I need to rule it out versus, the opposite. I had many patients when I was in clinic that had psoriasis, and they would come in and they would have, joint pains or some swelling, or some, weakness getting up in the morning. And a lot of them just assumed that it was getting older or just being out of shape or, carrying extra weight. And so they wouldn't bring it up by themselves because there's, a lot of people don't know the connection. So fortunately, we as dermatologists are trained to seek that out. So it's often anybody who has psoriasis should be evaluated for psoriatic arthritis. And it's not just a one-time thing. So that's another reason that it's good to be managed by, a reputable provider, because you have to keep bringing it up, because you might not have it 1 year, but you might develop it later. And as you and your audience probably knows, catching psoriatic arthritis is really a big deal because you really prevent the sort of irreparable damage that can happen. So earlier is definitely better with psoriatic arthritis.
If I'm allowed to make a comment, I think that psoriatic arthritis in my practice or in my experience is the hardest to be diagnosed until they get to you or they get to me, because as you said, many patients will consider the joint pain as something that is part of their aging process. And some of them, they don't even think about the connection because the skin disease starts, or it happened 10 years ago or 5 years ago, or it comes and goes, or it's not so severe. They have a plaque, let's say in the scalp or on an elbow, that they get hydrocortisone cream over the counter, they apply that, they know it's going to work, and they don't make that connection between the skin and between the joint disease. The other thing that is very interesting is that there is no test in the world to prove that they have psoriatic arthritis. It's not like for rheumatoid arthritis, where people learn that these tools like rheumatoid factor and the anti-CCP, they give you the confidence to have a diagnosis. But for people with psoriatic arthritis, it's a lot of digging, like you said, a lot of asking repetitive questions, and then trying to figure out that, what is the pattern of their disease. Because there is something specific about inflammatory arthritis. And for psoriatic arthritis, majority of cases, you get the diagnosis from, prior exposure, or they tell you that they had something related to their skin, and now they develop something that looks like an inflammatory arthritis. And I always appreciate these kind of conversations between rheumatologists and dermatologists, and this educational part that you may develop something. So if you have any joint pain, just tell me, or you ask, I ask. So that's very important. Now, I have a question also related to supplements. You probably know there is a $1 billion industry of supplements out there, and patients will go to choose these natural options instead of choosing medications. And I'm not against supplements. I actually promote the use of certain supplements, but I'm going to ask you, what do you recommend to your patients to be the best supplements with scientific background for patients with psoriasis?
Yeah, so like you, Diana, I do also promote trying to get as much of your supplementation through the foods that you eat. But sometimes it's just not possible. You may not eat enough quantity even to get to the therapeutic levels that you need to get at to experience some of these beneficial effects. So one of the best supplements that I often recommend are fish oil supplements that contain a really healthy dose of omega-3 fatty acids. You need about 2,000 milligrams per day of omega-3 fatty acids in order to achieve its anti-inflammatory effects. So, like I said, sometimes getting this just through your diet may be hard to eat enough fatty fish or nuts that contain this essential fatty acid. And supplementation is therefore needed sometimes to achieve these effects. I also love to recommend probiotics because, as you also can tell us and agree, that having a healthy gut will translate to other healthy aspects in your body, not just your joints, but your skin too improves when your gut is healthier. Curcumin, which is the main ingredient in the spice turmeric, is a very potent anti-inflammatory. However, some people don't necessarily like the taste of it. I do encourage trying to add it to your foods and recipes. It's easy to do in salad dressings, in your scrambled eggs. But if some people don't like the taste, it is actually available in supplement pill form, which is great. And then lastly, vitamin D, that's actually often found to be low in people with psoriasis. So supplementation can actually be quite beneficial in those patients. But it's always, always important to get your vitamin D level checked by your healthcare provider before you just go on your own and decide to supplement with some random dose, because there can be bad side effects like kidney stones, et cetera, that you need to be careful and cautious with vitamin D supplementation. So you do that in conjunction with your healthcare provider.
I think that's important to emphasize the doses, because the doses matter. Too low of a dose will not be sufficient. Too much of a dose could be dangerous. And when we talk about vitamin D, I have a lot of patients coming to me and telling me about certain protocols that they have been aware, and those protocols are promoted usually by people that do not have enough experience to talk about that. And when I'm talking about protocols, I do refer to this huge amounts of vitamin D, like 50,000 units every day, that are promoted out there by people that do not really manage autoimmune diseases day by day. So do you consider that appropriate? Have you seen patients with that were reporting taking these huge doses? Did they improve?
Yeah, I do not consider that appropriate. You definitely need to check their vitamin D levels first before you can give them any recommendation as to what dose to start with. And then you have to repeatedly check them to make sure that the amount that you do recommend is getting them into the therapeutic zone. So just randomly taking extremely high doses like that is very dangerous, in my opinion.
It also, the vitamin D levels fluctuate during the year, right? I mean, because
Yes.
the main way of getting it is sun exposure. So it's going to be different in the summer than in the winter. So that's another reason that you have to be in tune with what your levels are.
I would like you to give me some examples of the best foods that you recommend, and maybe the worst foods that you consider for people with psoriasis.
Sure. So, I mean, I'll start with some of the best, and some survey studies have sort of verified this, that people who eat more foods that are considered anti-inflammatory feel that their psoriasis is much better. And these include things like leafy green vegetables, spinach, kale, things like that. Fatty fish like salmon, that also is a great source of omega-3s, as Mary mentioned. Nuts like almonds and walnuts are really good. Fruit is good. I would encourage people to go with the sort of lower sugar fruit, like berries are a great option. Olive oil is a great source of fat. And all of these foods, it's not a surprise. So some studies have shown that the Mediterranean diet, which most people have heard of, because of its positive effects on heart health, among other disease conditions, it's been associated with improved psoriasis. So people who are more likely to follow a Mediterranean diet are more likely to either not have psoriasis, or if they do have psoriasis, have it less severe. And the reverse is true. So if you're less likely to follow a Mediterranean diet, meaning you have foods that are more inflammatory, you're more likely to have psoriasis or severe psoriasis. And some of this holds true for psoriatic arthritis too, I believe. I think that there have been some studies, I wanted to get your opinion on that, which makes sense, right? Because it's all sort of related to the same underlying inflammatory condition. So sticking to that type of diet, it's not a surprise. It's minimizing sugar and ultra processed foods. Mary will go into a few of the other things to avoid, but diets that have antioxidants, anti-inflammatories, polyphenols, healthy saturated fats, monounsaturated fats, those are the ones that are going to really support your skin health. Mary, do you want to
Yeah,
talk?
and yeah, so like Maria had said, and since some of the worst foods that you can have that can flare or trigger your psoriasis are, of course, processed foods. Foods that also have added sugar. Some people are sensitive to wheat, and in those people who they may not necessarily have celiac disease, they just have a gluten or wheat sensitivity. In those people, that can actually trigger people with psoriasis to have a flare. And of course, alcohol is definitely an inflammatory product, and there is an association with more severe psoriasis in those who consume, I'd say, excess amounts of alcohol. And processed foods just contain all kinds of crazy chemicals that weren't even meant to be. They're not even real foods, some of them. So they're not even by nature meant to be ingested, and they can just really be triggering and ignite a whole inflammatory cascade in your body. And if you have psoriasis, watch out, because it's like putting a match to gasoline.
I am very, very happy to hear your recommendations because they match exactly my recommendations for people with rheumatoid arthritis. And myself, I have done an extensive amount of work to study the science behind certain recommendations. And my journey started when I heard patients telling me that eating certain foods or, taking certain supplements, they were helpful to them. So what I've done as a researcher with my researcher mind, I went on PubMed and I was researching basically everything that they were saying. Like, for example, somebody was saying to me that they started a curcumin supplement or turmeric supplement. And I have to be sincere, in my cuisine culture, minimal culture about cuisine, I have never heard about turmeric before. So I learned from my patients. And when I went and researched turmeric in relationship with rheumatoid arthritis, I was surprised to see how much evidence or scientific evidence was to support that. And the same for fish oil. I mean, I knew about fish oil that is helpful for cardiovascular health, to modify or decrease your triglyceride level, improve that cholesterol, good cholesterol. But I had not even thought that fish oil would be beneficial for arthritis. Of course, if you think deeper and deeper, you realize that all these diseases, chronic diseases, they have something in common. They have the inflammation in common. And whatever is going to help the heart disease, inflammation that leads to heart disease is going to help inflammation that is going to lead to joints. And what I also have to tell you is, like, the more specialized we get, the more we lose from the big picture, unfortunately.
Yeah,
So
totally.
I started to realize that just bringing things together, it's so beneficial, not only for the joints, but also for the skin, for the dry eyes, and the same for the cardiovascular disease. And Maria, you asked me about psoriatic arthritis. I have a recommendation exactly like yours for my patients with psoriatic arthritis. And the thing that you mentioned about processed food, the things that you mentioned about gluten sensitivity, I educate them the same, because you don't have to necessarily have that gluten, that celiac disease.
Right.
And just by removing gluten or sugar, just taking out the extra sugar that you put in your coffee, in your tea, or those extra cookies that you're going to eat during the day as a snack, that makes a huge difference in terms of how you control inflammation. And yes, you cannot cure the disease, but what do you prefer? To have a disease that is out of control or a disease that you can manage?
Yeah.
And
Yeah.
I do make these correlations with diabetes, because when they hear about autoimmune disease, they're very scared. My patients are very scared. And I try to give them that understanding, like you manage diabetes or high blood pressure, you're going to manage this too, correct?
Yeah.
Yeah,
And,
definitely.
first of all, congratulations on listening to your patients. That's a great thing to do because we learn a lot from them. But to your point, it's so true that it's all connected. So it is easy to get into the rabbit hole of being very specific about something. But, psoriasis is associated with a higher risk of diabetes, of metabolic syndrome, of heart disease. All of those things are connected. And, the processed food in the US, I think now we're at around 60% of our diet is the ultra processed foods. And that study just came out last month that shows that people who consume a lot of it are more depressed. So, the mind is affected too. So it's important for your audience to know that they have some control over a lot of these symptoms that they might not realize are connected.
That's very true. A while ago, I've done an online course about nutrition. Actually, the course was designed to understand the science behind all these nutrition recommendations. And what I was surprised to learn in that course is that, when you enter into a store, the first thing that you see are those lines of boxes, correct? You don't see the produce. The
Right.
produce is somewhere in the back of the store. And I started to pay attention to this, and I was really surprised at what they were saying. This is true. So in terms of what do you need to choose to eat? Because that's the question that I get from my patients. Like, if I'm going to remove this, what is left for me to eat? And
it's a good question.
And I always say, when you enter in the store, try to find the produce first.
Yeah.
Fill the cart there, and then you move to the other part of the store.
Yeah.
But I think that the reality is that patients are scared because they don't know what they can choose.
Yeah.
They don't know they have a ton of options, and they just need to be educated. Now, tell me about what you are doing. Tell me about your platform. I'm very excited to hear and to learn. And I always read your blogs and your posts because I find them very, very good in terms of aligning towards a better lifestyle that will control autoimmune diseases. So tell me about what you are doing to share with the audience. And, I invite everybody to read on your platform.
Great. Mary, do you want to start?
Yeah. So Maria and I developed an educational online platform where you can find us at www.integrativederm.org. And on that platform, we've created resources that are science-backed, that we researched. We combed through the medical literature and translated it for the general public to be able to understand it and digest it. And it actually is a great, reliable resource that you can turn to for direction on how can I make these changes in my lifestyle, and how are they even attainable, and why should I make them? And we say, well, this is why, because we read the science behind it and showed that there's actually evidence and proof that these changes will help. So we are not only on the web, you can also find us on Instagram at Integrative Derm, Facebook and LinkedIn as well at Integrative Derm. And we share small posts, often weekly, to just with one key pearl, one little snippet of information or advice that you can practice or read about and learn about. And then you, as the consumer audience reading it, take it from there and have fun exploring.
And we're just huge proponents in empowering people to take a more active role in their own healthcare. So in addition to the excellent care that they're getting through sort of the mainstream medicine, it's great to be able to provide information that people can implement in their lives and be involved in their healthcare in a more robust and meaningful way. So, and we're looking to do cool things. So we're going to launch, we have an Eat for Your Skin campaign that we're going to launch soon. So we're partnering with a really wonderful prepared food company called Modify Health, who believes a lot in the food as medicine movement. So when that launches, we'll definitely tell you so you can share with your audience, but they're going to offer discounted meals. We're going to ask people for 6 weeks to eat a little bit healthier with the help of some of these discounted meals. And then at the end, send in a testimonial about their skin, and they can be entered to win one of 2 grand prizes. So, it's just to show people that what the decisions that they make do make a difference for their skin.
I think that's the most important thing. Once you see the effect on your skin or the effect on your joints, you're going to be very motivated to continue. Any piece of advice for people with psoriasis and psoriatic arthritis at the end of this conversation?
Yeah, I mean, I would say, 2 or 3 of the pearls that we've given, both for psoriatic arthritis and psoriasis, and go with it, and don't try to be perfect. Nobody's perfect. It's just about making a better decision every day. And remembering to be kind to yourself. It's hard to make these decisions. It's hard to change habits, but it's worth it in the end for sure.
Yeah, and to add to that, my other pearl is when you're in the grocery store and you're feeling overwhelmed by all those aisles of boxes, shop the perimeter of the store. The perimeter aisles are the ones that contain the fresh produce, minimally processed foods, meats, vegetables, fruits. Try to buy fresh and try to buy things that look like they did when they were harvested from the land. Or as much as close as possible.
That's a wonderful advice. Both of you gave us very, very good advices, and I'm really happy to share them with the audience. And I want to thank you very, very much. I feel fortunate to know you, and I'm going to continue to follow you because you really give people great advice.
Well, we feel the
Thank
same
you.
about
Rheumatologistoncall.com